Hi everyone, welcome to Acupuncture 123 Live. This is my treatment times, and I do scalp acupuncture on myself every day. So this is about self-treatment. And this self-treatment, I'm going to give myself scalp acupuncture. Let's talk about if I suffer from stomach pain. If you have a patient suffer from stomach pain, how are you going to treat it? What is your strategy, right? Now today, I'm going to combine scalp acupuncture as well as balance method acupuncture to treat stomach pain. Now, first, I'm going to let you know where about the stomach pain is. Then second, I'm going to show you the scalp acupuncture area and how do we needle it. And third, then we're going to combine the balance method acupuncture and which area that you're going to treat it. And we're going to define that to acupuncture 1, 2, 3 in 3 different steps, and to show you how exactly it can treat all the meridian in the tummy, right? The best area ever, right? We know what we talked about yesterday about the stomach pain, that how to do acupressure point, right? Exactly those points I'm going to show you today. I'm going to need on myself today to show you exactly those points. Then if you are on YouTube right now, please give me a thumbs up, or Facebook, give me a thumbs up as well. And as well as saying hello to me and let me know where you from and let me know about you, right? It'll be good for you if you're on Facebook. Please share this video or tag your friends into this video and let them know that I'm here to share acupuncture knowledge. All right. So if you let me know what you want me to talk about in the next topic or in the future, and it'll be good too, right? I'm happy to share, but I do have to do say something. I do have to apologize to you guys that some of your disease that you want me to show the point, some of them is too difficult to let you know, to tell you what point it is. Okay, if you keep following my video, my live video, you know how acupuncture 1, 2, 3 work. We're gonna follow acupuncture 1 through 3, right? And I hope you learn something from my video. All right, let's start now. Where about stomach is? Okay, stomach is that area of anything above the umbilical, right? So a lot of friends from India. Hi, Dr. Tik Chand Sharma. Nice to meet you. Nani from India. Nice to meet you too. So this is stomach, right? Stomach area over here. Then acupuncture 1, the 6th meridian. The stomach meridian is in here, right? Then spleen meridian is over here. Then spleen meridian over here. Then there will be liver meridian and gallbladder meridian on the side over here. Then we have kidney meridian over here as well, run meridian, right? So which means we have 5, 1, 2, 3, 4, 5 different meridian over here, right? Then on run meridian in here as well. So 6 different meridian. So 5-foot meridians, 5-foot meridian. So one of the meridian is not going up here, which is UB meridian, which is in here, right? Amida say, yes, I learned a lot. Thank you, Amida. So this is the area. This is the area. Okay. Now, this is what we call middle jaw. Middle jaw, okay? From here to Jiwei, right? So with scalp acupuncture, 220. Let's say over here, this is umbilical, this is neck, and halfway is right here, right? So the stomach area is from here to halfway, not that far up here, right? It's low in here, stomach is over here, right? The pain is over here. Let's say it's pain over here, right? What we're gonna do, umbilical, 220 over here. Then over here, umbilical and halfway, and neck is hairline. That's neck. 220, right? 220 hairline, and halfway. Let's say this is halfway. So which means this stomach area is from here to here, right? And I do want to tell you this is according to Dr. Tan's scalp acupuncture, right? Dr. Tan's scalp acupuncture. But in true scalp acupuncture, if you have learned true scalp acupuncture, you would know that, wow, the 220 to here, part of it is lower abdominal. But on Dr. Tan's scalp acupuncture, this part does not treat lower abdominal. It actually in the middle jaw, which is middle jaw over here. From here to here, this is middle jaw, and lower jaw is over here. But in true scalp acupuncture, in this part, it actually treats lower jaw as well. That's why I say when it comes to Dr. Tan's and Dr. Chu's scalp acupuncture, some of them are similar, but some of them are different. They treat trunk over here, but it only treats stomach over here in Tan's acupuncture, scalp acupuncture. If we do acupressure instead of acupuncture, is it equally effective? Good question. Yes and no. Yes, you can get equally effective, right? But no, you may want to spend more time on acupressure point. With acupuncture, you just put needle in, okay? It's much easier. It saves a lot of time. But if you're in a mesotherapy, or you use just you just do trainer and you can't do needle, yes, just do it with acupressure point. It will work as well, right? In this part, what we're gonna do right now, I'm gonna needle here to I haven't got pain, right? If this patient comes with pain, then you know you can find the access point. But if this patient comes with bloating all over here, then what you're gonna do, you're gonna cover all the area. And cover the area right now, 2 meridian and halfway from here to here, halfway, right? So we're gonna do the middle one. When I do the middle one, right, I'm gonna do 3 different directions, right? So my direction is going that way and that way. This is the needle, okay? That way, and I leave it in the middle, right? First getting that way first. 1. Now next I'm going, you can't see the needle, but I'm going to let you know what way I'm going to do. I'm going to do that way right now. So this is covering the image. Then I'm going to do the 2 meridian. Oh, I accidentally pull out the needle and the needle is bent. I can change the new one. Change the new needle and place it on the 2 meridian. To by way. And the 2 meridian can treat the 1 meridian over here. All right. Then what happened? I'm going to add 2 more needles. Right. If you're treating that, you're going to find the access point over here. Right. If you can't find access point, then what I needle in here. Then what I'm going to do here, I'm going to, the trunks over here from here to here, right? That's the trunk, right? That's the trunk. And where do you go? The next needle going to aside this is going to be in here, GB meridian up here, and this is UB meridian, right? So put one needle in between GB and UB, right? So one needle in between GB and UB on the same level of the one that I just did. So I'm going to cover the image as well. In the image, again, I'm going to put needle to that side first. Needle that side. You can't see the needle, but I'm going to let you know what's the next step I'm doing. Needle is going that side now. I'm going to pull it out that way. Pull out. I'm going to change the direction. You don't have to pull it completely out, all right? You're going to leave the tip still in the skin, and I'm going to change the direction, go from there to that way, all right? So therefore, I cover the whole area, the map. Okay, the needle is going in there. I'm going to pull it out that way. Then it directly go to that way. To the back. This point is at between GB and UB. Okay. Now, of course, you can do the needle. I'm doing it from the front to the back. You can do it from the back to the front, and that's okay. It's not a problem at all, right? As long as you cover the image, right? Now, the other needle, I'm gonna put it in here because I want to cover all the map. So I want to use 3 needle and cover all the area. Okay. The next one is between here and here. Go straight up. Right. So that is this one is that one's GB meridian, and the same area over here and between that. Right. Let's put needle in. Put needle in. Now I'm going to do that area first. Point to here. Oh, that's a bit painful, so I don't go straight in. I pull out a little bit, change a bit of direction. That's still painful. Change direction. Always change direction a little bit when it's painful, right? So go straight in. It's in now. I'm gonna pull it out right now. Pull it out and change direction to here and in. Okay. Pull it out. Change the direction. You really want to pull it out just about all out, but the tip still remain in the skin. Therefore, you'll be able to change direction. Okay. If you pull out completely, that's okay too. You just needle it again, put it in, right? So I change the direction already. So I'm gonna put it over that way. I can't see it myself though. I just feeling it. If my direction go that way, you know what I mean. You know what I mean. I'm just showing you what I'm doing. Moment. Okay. I'm twitching the needle while I push it in. It's easier. Okay. Then I pull it. It's all in. It's in now. So I pull it out again. Cover the image. Then I turn the needle into directly go to the back side. Oops. Accidentally pull it out. Doesn't matter. Just pull it in again. Okay. That's it. 3 needle, right? Now again, this is just on the middle jaw, and I should put, because middle jaw is from here, from the stomach, right? It's halfway. I should put another needle over here to cover it up. Cover all the upper abdominal. Okay. So I'm putting more needle in. Okay, I'm putting more needle in again. Third needle. As soon as you cover all the area and you do different direction, cover all the map. And what happened is, if this patient have pain in the stomach, and they should get immediate relief. If they don't get immediate relief, if they feel a bit relief but not completely gone, then the next movement you can do is go back to all the needle and do different level. All right, do different level on. Then next step, if you do it in here, you want to double the effect. Double the effect. What can you do next? Well, we talk about we're gonna do acupuncture 1, 2, 3. Use balance method acupuncture, right? Or if you needle here and the patient feel better and that's still a little bit in there, and you want to take it further, you want to get the result even better, and that's another thing that you can do. So we combine scalp acupuncture with balance method acupuncture, right? And the scalp acupuncture, to be honest, any kind of scalp acupuncture, you can use it. No problem at all, right? I'm not saying that you must use Dr. Tan's scalp acupuncture, you must do Dr. Chu's scalp acupuncture or Fang's scalp acupuncture or whatever, or there's Japanese scalp acupuncture. You're welcome to use it, right? You're welcome to use it. And for me, I'm familiar with Dr. Tan's, Dr. Chu, and Zhao, and Tang scalp acupuncture. And I haven't been showing you Tang scalp acupuncture because Tang scalp acupuncture is even simple. It's just in one area and it's different direction, and it treats the entire body. And Master Tang, it's just I'm so amazed that he can find out all this different direction and work for the entire body. And that's another thing that we may talk about in the future. I need to talk about with my master first before I introduce to you. And here you go. Let's say we do it now. We want to do it further, right? We want to bring this result even further. Now, what can we do? The acupuncture 1, 2, 3. We're going to follow those 3 steps. You want to learn this 3 steps very well. And this is distal acupuncture. Of course, you can needle here. Nothing wrong with that. But if you needle here, if it doesn't work, where should you needle next? If you needle distal acupuncture, you need to understand the meridian, the 6th meridian. Now, I'm going to show you quick and dirty way. When I say quick and dirty way, means that scalp acupuncture, the quick and dirty way means the pain will be maybe in the run meridian, then we took care of it already. If the pain is in kidney meridian or stomach meridian or spleen meridian or what, liver meridian or gallbladder meridian, we're gonna cover all this meridian, which means what we're gonna treat right now is, doesn't matter where the pain is, we're gonna treat all the meridian over here. Let me go with you. If acupuncture 1, the meridian is all the meridian in here, which is 5 of them: kidney, stomach, spleen, gallbladder, and liver. 5-foot meridian in there. Then we're going to use acupuncture 2, 3 hand-in meridian. And how do 3 hand-in meridian be able to cover and balance all this 5-foot meridian? And I'm going to let you know in a second. The lung meridian, it can balance liver meridian. It can also balance spleen meridian. And the pericardial meridian, it can balance kidney meridian. It can balance liver meridian. And it also can balance stomach meridian, right? And that is pericardial meridian. Balance kidney meridian. It can balance gallbladder meridian. So we got gallbladder, kidney, as well as stomach and spleen and liver, 5 meridian, and all balanced by those 3 hand-in. So as long as you go ahead and needle and searching the point on those 3 hand-in meridian, then you're gonna cover all this stomach problem, but not for run meridian. But remember, run meridian we covered on here on the 2 head meridian already. Now let's go step by step. This is belly button, right? And the pen will be above the belly button, right? And from here to here, this is halfway over here. And the pen is actually between the halfway, from the halfway to here, to belly button. So which means this is neck, this is belly button, halfway. We're going to treat halfway closer to the elbow, from here down to here, right? And that's simple. Acupuncture 3, we're going to find out the R point. The R point, which means is sensitive point. Now, I want to let you know, you may not be able to find which R point. If the patient, I shouldn't put it that way. In reality, most of the time, you'll be able to find the R point, the sensitive point. In some cases, you may not be able to find any R point at all. Why is that? My suggestion for you to get to the point is, you're going to get to the lung meridian first, right? You're going to press it and ask your patient, is it painful? Is it painful? And some of the patients will say, oh, yes, this is painful. And then you're going to find out, is that one? How about that one? Oh, this is painful too. And you're going to compare which one is more sensitive, right? Which one's more sensitive? And the patient will tell you. But instead of asking, is it painful? Then you just let your patient know first, I want to palpitate over here, and I want you to let me know which one is the most sensitive, rather than say which one is more painful. Because some patients, they don't feel pain, they just feel sensitive. The sensitive point will be probably just achy, they won't say it's pain. Probably will just a bit more pressure, it's not a pain. They won't say, oh, this is not a pain, it's just a bit more pressure in there, more sensitive. So you more sensitive will be better for you to get to the point, right? So 1, 2, 3. Oh, number 3 is the most sensitive one. 4, 5, 6. This is halfway now. None of them is just that one. For me, this is just 1 point and a little bit in here, but this is the most one. How about here? And nothing in here. That one's the worst. So I normally use 40 mm needle, but today I only have 25 needle, 25 mm. So I insert this one over here. Okay, now I'm not going to put it all in like this. I won't suggest you do that all in. Why is that? Because you're going to palpitate the other point. If you palpitate the other point, the muscle here, you'll press it on there, and it might cause pain from here. So normally you just, when you get to the point, you insert needle in, superficial, and that's it. As long as the needle won't fall out, okay? Secondly, you go to the, what do you call it? Pericardial meridian. Then you go, is it tender? Yes, a little bit tender, but sensitive. Find out the sensitive one. Oh, my one is over here. This is sensitive, very sensitive. And a little bit in here. That one in here. So that's 2 points over there. So I'll put one needle in here. Of course, you can use the tube, and I like to use just freehand. One needle over here. I don't know whether you can see it properly or not. Okay, over here. Now, next one is heart meridian. So of course we go from here. There's tender over here. That's tender too. That's tender too. So here and here, that's the worst. So put one needle over here. I lost the point over here. Yep, over here. That's it. I got 5 points. They are all on sensitive point on those meridian. Right now, when I get all the meridian, the point in, so I slowly insert the needle. Go in. Go in like this. That's it. Simple. And you can leave the needle for 15 minutes, 20 minutes, or up to 40 minutes, 45 minutes, and that's up to you. Right. So this is scalp acupuncture with balance method acupuncture. It is so simple. I just show you how to do acupuncture 1, 2, 3. If you have any question about this, you ask me all the question, and I'll take time to reply you. And one thing, I'm just showing you, sharing with you how to do acupuncture 1, 2, 3. And again, a lot of people ask me, hey, how do you treat stroke? And can you show me the point for muscle pain? Which point is best for muscle pain? I don't know. I really don't know. You need to tell me which meridian in which area, and I'll be able to let you know where is that. If you've been following my video, my acupressure one and acupuncture one, you know when I do balance method acupuncture, I always follow acupuncture 1, 2, 3. You're not helping me to give you an answer to help you, because if you're just asking me which point is the best for headache, I receive a lot of text to me and a private PM me and say which point is good for neck pain, which point is good for headache. I would suggest you go to all my video. I've done all the video already, and if you've been following my video, you know you have acupuncture 1, 2, 3. Let me share with you. Acupuncture 1 is find the 6th meridian. At least when you ask me the question, you ask me, I have a patient headache, and the headache is on gallbladder meridian, UB meridian, and up to let me know all the area as well. I have a patient have shoulder pain, but the shoulder pain is on lung meridian. Then I'll be large intestine meridian and on the and you get on the ulcer point on the large intestine meridian. That I'll give you exactly the point where the ulcer point is. So if you want me to help you, you are welcome to ask any question, but be smart. Follow acupuncture 1, 2, 3. Let me know the sick meridian and the area. Then I will answer you properly. So too many of you ask me the question. I feel useless because I don't know how to answer you. And my best answer for you is, hey, let's just follow acupuncture 1, 2, 3. All right. Age 26. Hello, I left a question in the comment section. If one of your last video I asked about treatment for non-allergy rhinitis, runny nose, which occur. Are you answering my question? I can't hear properly. It's cutting. Yes, I'm answering your question. Now, for nose problem, we know where's the nose problem over here, right? It actually related to this meridian over here in the middle. Then what you can do, let me show you. Right, for the nose problem, over here and here, halfway and here. So you can do lung meridian, halfway from here to here, lung meridian, and large intestine meridian. From here to here, halfway on your forearm. This is for nose problem, and as well as needle over here, hairline over here. Just the point, sensitive point, and you want to get rid of all the sensitive point. And another thing is you can gently massage over here and to find this here. If you can get the ulcer point over here, you want to get rid of all the sensitive point around your nose. Right, that is local treatment with distal treatment. All right, I hope that helps. That's it for today. That's it for the needle. I know a lot of people love to use it, works, but it doesn't treat the run meridian. And large intestine only treat what? It can balance stomach meridian. It can also balance liver meridian, and kidney meridian, but it doesn't treat spleen meridian. It doesn't treat the gallbladder meridian. And the pain involved with gallbladder meridian, it doesn't treat it. And of course, a lot of people love to use stomach 36, right? It works too, but stomach 36, it can balance spleen meridian. It can balance stomach meridian. It can't balance stomach 36. It can't balance kidney meridian, and it can't balance liver meridian, and it can't balance what you call gallbladder meridian, right? And yeah, we use pericardium 6, right, to treat stomach pain too. So pericardium 6, pericardium meridian, it can treat liver meridian, treat stomach meridian, and it also can treat kidney meridian, but it can't treat if the spleen meridian involved with the pain, and it can't treat gallbladder meridian, so they always miss. So, but if you needle spleen pericardium 6 and stomach meridian, as well as hergu, which is meridian, but except it can't treat gallbladder meridian. So this is something, those 3 meridian you needle together, it treat all the meridian involved with the stomach, all in here. as long as you can find the access point. Now, let's say if simple, just put one needle in here, one needle in here, one needle in here. So 3 needle on lung meridian, and 3 needle in here on the pericardial meridian, and 3 needle on the heart meridian, and they cover all the stomach pain meridian. Once you treat all 3 meridian over here, then you find bloating will be gone, the pain will be gone if you can't find any sensitive point. This is the case if you can't find any sensitive point, okay? I teach in my webinar on the WeChat and treat everyone how to use local balance to treat internal disease. Of course, I did it in Chinese. All right, they pay me to teach them while this English yet. But in the future, I will teach everyone how to use local balance to treat internal disease. And remember, internal disease and balance method acupuncture, we always use global balance. But I figured it out, we can use local balance to treat it. And the idea from getting local balance to treat it is from my other master, the acupuncture, because scalp acupuncture is only using image, hands and leg meridians, and to treat disease. And the more important thing is it works. Very simple. As long as you cover the image, that's it. I already showed to you how to cover the image just now. If you get it, that's yours. If you haven't got it, keep following my video. I'll share more and more and more in the future, or you can sign up for my webinar in the future. All right. Stay awesome, and I love you all. It's my sleeping time right now. I'll see you tomorrow. Let me take out the needle first. Again, if you have any question, please leave your question there, and I'll come back and answer. And remember to give me a thumbs up and share. Yeah. Stay awesome. Love you all. See you. Bye-bye.